with which high school sport has the most concussions. It may not be the sport you think. Here with more on this, Dr. Douglas Wu. Doctor, good morning.
Hi, good morning.
Okay, the assumption everybody made is that we're talking about football here. That is not the case. Clarify for us, if you will.
Yeah, surprisingly enough, it turns out that the highest concussion risk in young athletes is in girls' soccer.
Really?
Yeah.
Is that surprising? Because, you know, over the years, at the younger ages, they've taken away the headers. You can't use your head anymore at the younger levels for soccer. So they kind of knew this was a problem?
That's true, but it's still not as surprising because
Sure.
soccer represents a risk that other sports really don't have, and that is actually heading, and in fact missing heading, which leads to head-on-head contact and perhaps on ground contact.
Now, why the differentiation between girls soccer and not boys soccer?
That's a very interesting question. We don't really know the full answer to that, but it turns
Sure.
out that women actually have a higher concussion risk than men in general. And the thinking is that it might be due to a few factors. Women tend to have smaller head sizes in general than men. Their neck muscles are also a little bit weaker, and so the stabilization there tends to be weaker. And finally, some scientists think that the hormonal influences and the differences between men and
Sure.
women may play a role in increasing concussion risk.
Now, this doesn't mean that there aren't concussions in football. We still have that problem, but obviously a lot of safety has been put into the helmets and the paddings in football. Football still causes concussions.
Absolutely, absolutely.
Okay, so let's talk about if you think your child may have suffered a concussion. A lot of parents have their kids, they go out and play after school, they're not necessarily witnessing everything that happens. How can you look out for the symptoms of a concussion?
The most important thing if you suspect that your child has had a concussion is to stop whatever activity is potentially triggering that concussion and see medical attention right away. There are some symptoms that might be suggestive of a concussion, such as headaches, nausea, confusion, sort of emotional instability, things like that. But it's very important to get checked out right away when you
Sure.
think that you've had a concussion.
And especially if it's very out of character for your teenager or for your child, take them to the doctor. Okay, let's talk about the long-term effects. Perhaps you don't go to the doctor and you're not treated for this. What are some of the long-term effects of concussions?
So in the first couple weeks to a few months after a concussion, you can definitely get repeated headaches and nausea, vomiting, sort of difficulties with memory. You can be confused, difficulty with balance, things like that. These symptoms can sometimes wear off and recover with appropriate rest and monitoring. However, in the long term, and especially with repeated concussions, there is a phenomenon that we call chronic traumatic encephalopathy that develops as a chronic neurodegenerative disease that usually results actually in prolonged, if not permanent, neurological disability.
Wow.
And sometimes even death.
Wow. Treatment, solution to this?
Absolutely. The treatment basically revolves around removing the trigger. And so rest is very, very important. You need to avoid another head injury of any variety while you're recovering from a potential concussion. I mean, when you get headaches and stuff, that can be treated symptomatically with things like Tylenol, etc. But rest is really the key.
We think that the professional sports, they've tried to improve how they treat concussions. If they suspect a concussion in the NFL, for example, they take a player out. Are you seeing that at the high school level, when the kids are playing and they see something, a headbutt or something like that, are they doing enough to make sure the kids come out for that time?
I don't think so. I think this awareness needs to be raised,
Sure.
especially in the young population where we can do potentially the most benefit.
All right, Dr. Douglas Wu, we thank you for your expertise this morning.
Thank you so much.